going to go to Dr. Juliet, and she's going to talk a little bit about the point of entry into the mental health care system.
Okay, so can everyone hear me okay?
Yes, we can hear.
Okay, well, thank you so much for allowing me to participate. I'm not in Ohio, but I am Nigerian. And I also want to thank our other speakers, my Uncle Victor, of course, Dr. Cox, and Ms. Martin. They have spoken so well on identifying stress and preventative measures, things we can do on our own. And I think, if I was reading correctly, one of the questions is, where is the point of entry when, that stress becomes more than just the stress that the average person is experiencing, and how do you seek help? Well, before you know to seek help, you have to know that there is a disorder present. So the people I'm seeing, the level of the symptoms that they're having has reached the threshold for a disorder. So where is that threshold, right? With the current stressors, COVID-19, riots, violence on television, those are external stressors that can overwhelm our coping skills and can overwhelm our baseline resiliency. And so I think that puts people at an increased risk. So some things that are more likely to pop up in this time period are issues with anxiety disorders, depressive disorders, substance use disorders, and maybe even PTSD, and then there may be some others, but those are the big ones. And they become a disorder when they impact function, significantly impact functioning. So they're overwhelming your functional reserve and your resiliency. So for example, with anxiety, we're all worried. We're all worried about finances, we're worried about catching an infection, we're worried about all these things. But is it to the point where the worrying is interfering with sleep? Worrying where you can't concentrate, you're overwhelmed with the worry. You're so worried that you're on edge, you're snapping at your family members, you're irritable all the time, you're tense, you're getting headaches, you're trying deep breathing, you're trying to distract yourself, and it's not working. That's the time to seek help. Depression, we're isolated, we may get lonely. Is it to the point where, you just don't want to be bothered? You don't even want to text. You don't want to call someone. You normally like watching TV, all of a sudden you're not even interested in that. If you try to watch TV, you can't concentrate. Your mind is wandering. You don't have any energy. You're either sleeping too much or sleeping too little, eating too much or eating too little. You're feeling worthless. Oh, well, where am I going? What's happening in my life? Feeling like a failure. Maybe thinking, I don't have a future. Maybe thinking, I don't care if I wake up tomorrow. Maybe a step further, I don't want to be alive. Maybe having suicidal thoughts, maybe even researching and starting to have a suicidal plan. That's a problem. That's when, and you don't want to wait till it's to that point, but recognizing these symptoms either in yourself or in the people around you, is a reason to say, hey, it's time to get professional help. With substance abuse, what's too much? If you look at what's defined as moderate alcohol use, it's 1 drink per day for a female. A drink is 1 beer or a 5-ounce glass of wine, 2 drinks for a male. And then what's considered binge drinking is 4 drinks for a female within 2 hours and 5 for a male. So anything above that is considered problematic. Not necessarily a disorder, but problematic. And so when you start needing more and more of the alcohol to get that buzz, to feel relaxed, when if you skip a day, you start getting shaky, where you're spending money that's supposed to be for something else, for your bills, on alcohol. Where are you driving and drinking? Is your family starting to criticize your drinking? Are you getting in fights because of your drinking? Are you noticing that it's affecting your mental health, your mood, but you're still drinking because you can't control it? You're craving it. You're trying to drink earlier and earlier in the day. We don't want to wait till it gets to that, but is it escalating? That's the time to get some help. And then, of course, with PTSD, if you're getting triggered with nightmares and flashbacks and you're always on edge and, you're going jogging and you're worried that somebody's going to come after you. And that's a big one. I'm seeing people, worrying more about being outside exercising. They may not meet quite the threshold for PTSD, but, keeping an eye on those symptoms to make sure they're not going on. So if you're noticing these things, it's time to get help. And where, the safest place, I would say, that most people would not even argue about going to get help is with their primary care doctor. There's no stigma with seeing your primary care doctor. So when the primary care doctor says, how are you doing? It's okay to talk about these symptoms. And they might be able to refer you either to a counselor or to a psychiatrist. Some primary care practices have either a integrated system or a co-location of primary care and mental health. So when you talk to your family, you say, I'm going to such and such practice, they don't have to know you're going to see the behavioral health component of that particular practice. And so I don't know if there's something like that in Ohio, but here in South Carolina, we do have these practices where they're co-located and people feel comfortable. You know, I might have my primary care doctor appointment at 10 a.m. and I'll go see my therapist at 2 p.m. or whatever. And then, of course, seeing a psychiatrist for the medication aspect. Peer support is important, and so organizations like NAMI is very important for peer support for those who are suffering with mental illness, but also family support. Peer support for substance use disorder in terms of AA, and then Al-Anon for family members of those who are having substance use disorder issues. And then to continue to foster resilience is building your social supports. And that can be either friends, family, reaching out if you don't want to reach out, maintaining those people that you have there for you, and then spiritual outlets as well. That's a big buffer against mental illness. It's a big buffer against suicide. And so kind of maintaining those things that you do have, maintaining those connections can be important. So hopefully that kind of gives you some sense of when to involve someone like me and what kind of things to look for before it gets to that point.
Thank you so much. That was a very comprehensive answer. Just